Listen up, ladies.
I'm here too.
Well, then you should listen up with the rest of the ladies. Now today, we're going to be assessing respiratory disorders. And I'm sure you all read your chapters in health assessment and patho, right?
I mean,
I did.
Well, you better have read them, because today I'm going to be asking you about the HX, the SX, the TX, and the DX. And if you don't know all of them, well, hey, are you even listening to me?
What?
Did you hear what I just said?
Something about a DMX on a BMX?
I'm gonna make me lose my mind up in here.
Swing and a miss for Barbie. Moving on. Now here, we have Miss Henderson, a 78-year-old woman who was brought in last night due to her shortness of breath because of chronic bronchitis. So what are some of the hallmark symptoms of chronic bronchitis? Yes, Stephen?
Emily, chronic bronchitis patients typically have a blue-blooded appearance and a productive cough.
Oh.
Ew. Good job, Stephen. Now someone give me a nursing diagnosis. Yeah, John.
My name is Michelle, but risk for infections related to chronic bronchitis as evidenced by respiratory secretions.
Nice work. And treatments?
Oxygen therapy, bronchodilators, and...
Corticosteroids.
Ah, Tiffany, you almost had it. Good thing you got Frank over here to pick up the slack. All right, Lemmings, on to the next one. And here we have Mrs. Walton. She's a 65-year-old woman who was brought in this morning by ambulance because of shortness of breath due to her emphysema. It's important to note that Mrs. Walton was a 2-pack-a-day smoker for the last 15 years.
I guess 2-pack wasn't just her favorite rapper, right?
Wildly inappropriate. All right, you guys remember your health assessment. If we didn't know Mrs. Walton's diagnosis, what's the first thing we'd do when we met her?
Assessing her pain on a scale of 3 to 6.
Wow. Ugh. Strike 2. So take this and get back to me. Does anyone else have an idea?
Well, first, you do a quick visual inspection of the patient. Usually, patients with emphysema have a pinkish color skin. They are thin with a barrel chest and purse their lips like they're puffing air.
Yeah, very good, Gerald. Now, how would this be medically diagnosed? With a chest x-ray or a CAT scan?
Well, that would never work.
Chest x-ray.
Barbie's back in the game. I need a nursing diagnosis.
Impaired gas exchange related to emphysema as evidenced by low O2 sat.
That's another slam dunk for Frank. And finally, how are we going to treat her?
Pretty much the same as chronic bronchitis, oxygen therapy, bronchodilators, corticosteroids, and smoking cessation.
Hey, it's okay if I smoke in here, right?
Absolutely not. And now we have our last patient of the day. Now, Miss Jones is a 21-year-old who came to the hospital today. She was having an asthma attack. Now, Allie, can you tell us what triggered your attack?
I was just playing with my cat. He's such a little demon.
All right. Now I need a nursing diagnosis.
Ineffective airway clearance related to weird relationship with her cat, as evidenced by increased worker breathing.
Nice job, Stephanie. How are we going to treat Miss Jones?
Oxygen therapy and use of a beta-2 agonist and an nebulizer.
Good job, Steve.
It's Emily.
Well, as much as I hate to admit it, I was wrong about you ladies. You obviously knew what you were talking about.
Still here.
Of course you are, Stephanie. Of course you are.